Hello, this is a case of a 75 years old patient who presented with a left-sided hearing loss, and we have performed a special MRI that is focused on the internal acoustic canals with thin slices T2 imaging, as well as standard MRI. This sequence is most sensitive to look at the internal acoustic canals. And what we can see in this patient is that on the right we have no tumor in the internal acoustic canal. We have ICA loop, vessel loop in the level of the porus. That is normal finding, but it's good to mention it in case of patient registering pulsatile tinnitus. That can be information significant for clinician. Now on the left side, we can see that there is something black inside this internal acoustic canal. We measured about 5 millimeters long, 3 millimeter in diameter. So here is the porus, here is the cochlea, and here are the semicircular canals. And we can also look at the coronal slice. This is the slice corresponding that shows the tumor more clearly, as well as the sagittal slice that goes through the tumor. So the moment we are hitting the tumor with the slice, it is just plaque in the internal acoustic canal. There is a funny thing that I use for anatomy of the internal acoustic canal. So if you look at this slice of the normal right side, you can see that it goes like this. It goes transversally to the axis of the internal acoustic canal. Now on some projections you can imagine that it looks like a face of the monkey, so indent in the forehead and here a face. And on some sequences it depends on the angle. This one is angled like we have it, so you can see small eyes and the mouth of the monkey like this. Now mouth of the monkey is in the shape of V letter, and this is the vestibular nerve. And what we have is the on top we have the superior vestibular nerve part. Then below we have the inferior vestibular nerve. Then we have the right eye of the monkey, that is the cochlear nerve. And then we have the left eye of the monkey, that is the facial nerve. Now we always remember those two dots, and the one what is upper is up, so we can also remember it's a 7-up, like a drink, 7-up. So this is the facial nerve. We also performed in this case study with contrast. This is the one with contrast that shows enhancement of this tumor. It is quite nice to see and good for a follow-up. They might use some radiotherapy for the tumor or just follow-up. Sometimes this tumor can be even smaller, like 2-3 millimeters deep in the internal acoustic canal. Here we have the coronality one, post-contrast, that shows contrast enhancement. And here we have, just for comparison, the standard T2 axial slice. Of course, it would be easy to miss. It is visible on one of the slices. You can see it here, the Vestibular Schwannoma. So here it is. Now, if you like this type of case presentations, you can consider reviewing my previous cases and subscribing. Thank you for watching.
Screen glows green for the final act, final act. Paper trail signed, every word of fact, word of fact. Berlin steel rolling toward the north, 60,000 missing from the sun put forth. Findings AS, a ghost in the machine, buying down the silence of the motor unseen. Minus 40, a ghost in the shell, 0% heaven or a high-tech cell. June 5th coming, the silver and gray, letting the old world dissolve away. Hudding to Nike-Von, a new path cleared. Shadow of a Volvo, the distance is mirrored. No more fossil breath, just the hum of the wire. VIN code decoded, fueling the fire. Wait for the app to speak, for the light to turn on. The incentive is gone, for the light to turn on. Wait for the app to speak, for the light to turn on. The incentive is gone, but the future is one. Minus 40, a ghost in the shell, 0% heaven or a high-tech cell. June 5th coming, the silver and gray, letting the old world dissolve away. The silent transition, gray skies, bright lights, RP Radiology logging out.